Hello, my name is Riley Johnson. I am an MSN student at Mount Mercy University. For my MSN project, I have completed it to improve pediatric triage and comfort level in the emergency department for staff nurses. At the University of Iowa, it is a general emergency department where the triage area includes adults and pediatric patients. And sometimes there are general nurses, adult nurses who don't take care of children as often, who triage these patients, these pediatric patients. So it can create some uncomfort, and they're not sometimes as confident in their triaging. And so this project was focused on improving the comfort level, which in turn may improve the acuity levels to be appropriately assigned to these pediatric patients. So for the University of Iowa, they utilize what is an emergency severity index triage tool for pediatric triaging. It is level 1 to level 5. Level 1 is the most critical, and level 5 is the most non-urgent. Pediatric patients can be triaged, like I said, by any general nurse or a pediatric nurse as well. So my goal was to improve their comfort level, to also improve the accuracy of the triage acuity level assigned. It is clear that more education and resources are needed to improve this comfort level. The literature review that I completed focused a lot on the pediatric assessment triangle, which you can see here in the center of the screen underneath gaps and barriers. It is a great, quick tool on initial assessment for pediatric triaging. It looks at appearance, work of breathing, and circulation. And this is not utilized currently in the emergency department at UIHC. This is Pediatric triaging is a critical skill that can be the difference between life and death in some pediatric situations, because they can only compensate for so long and they can begin to deteriorate. There were also some educational methods that were found in my literature review, such as a paper-based and simulation education, that have helped improve comfort level and accuracy of triage level assigned. And then, since the university uses the emergency severity index tool, I did find an article that states it may not be completely accurate or the best tool for pediatric triaging. So it's clear that we needed more educational resources and different tools to utilize for pediatric triaging. Gaps and barriers found in the literature review and in the assessment of UIHC is that general ED nurses can and may inaccurately triage pediatric patients just because of the lack of education. The pediatric assessment triangle, or PAT, is not utilized in all triage assessments and should, because it's a very validated tool. Triage assessment tools, they vary from hospital to hospital, so maybe standardizing this would be helpful, and also standardize that education. So the plan for this project was to review the current educational materials and the current triage orientation checklist, collect baseline data regarding the staff's comforts and knowledge on pediatric triaging, revise and develop those educational materials, and educate staff nurse on the pediatric triage assessment, and provide those references for them. For the implementation, I did an email that was focused on pediatric triaging, and we called it Triage Tuesdays, to educate staff on fever protocols that we have here. Presented on the pediatric assessment triangle. It is now implemented throughout the department. Fever protocol and high-risk pediatric conditions that are specific to the pediatric population. And then updated the area where documents of educational materials are. It's in our ED resources tab. And then you can see that rainbow colored chart there. This is actually a pediatric vital sign badge hanger for nurses to wear on their badges so they can reference that, um, since each age is a little bit different on vital signs. And then I revised the pediatric orientation checklist. Evaluation. I surveyed the staff nurses after the implementation of all of this to reassess their comfort level if it improved. And this assessment also included generalized questions about acuity level to assign to patients, pediatric patients, to see for accuracy of the triage level used. Um, and then continue to revise educational materials as necessary and continue yearly pediatric education on triage, because in the literature review, it states that general nurses who triage pediatric patients not as often should continue and have updated education to provide the best triaging that they can for pediatric patients. So this has been very helpful for the University of Iowa Emergency Department. And this project was very helpful for a lot of the staff nurses. If anybody has any questions, please feel free to reach out to me by email. And this is still an ongoing thing at the university. So hopefully we will continue to improve the comfort level and accurate triage acuity assignments for pediatric patients.